What comes to mind is an old saying that if you ignore your teeth, they'll go away.
Mm-hmm.
I think that's a true statement. People may think they can get away without daily hygiene. I think that's kind of important that you should at least get your teeth taken care of at least once or twice a day by brushing and flossing. I mean, this has been proven. Our dental people have really taken the lead on preventive care with oral hygiene in that respect.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Raymond Scarpa, Clinical Program Manager of Head and Neck Oncology and Supervisory Advanced Practice Nurse in the Department of Otolaryngology at the Rutgers Cancer Institute of New Jersey at University Hospital in Newark. We will be talking about oral health in patients with cancer. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Welcome, and thanks so much for joining us today, Ray.
Oh, thank you for having me. This is quite an honor. Thank you.
So let's start our conversation today talking about some of the basics of oral health. How would you define oral health, and why is it so important for patients with cancer?
We know that the mouth is full of bacteria, and most of them are harmless. Some actually aid in digestion. But we do need to realize that the mouth is the entry to the digestive tract and to other organs that lead to the respiratory tracts. So some bacteria in the mouth can lead to disease throughout the body. Poor oral health can lead to gingivitis. This can progress to periodontitis, and that comes in various stages. When this happens, it puts individuals at risk for cardiovascular disease, pneumonia, and of course, oral carcinomas. Nutritional intake can also be altered due to oral discomfort. Patients with other medical conditions such as diabetes, HIV, rheumatoid arthritis, and other autoimmune diseases are at risk due to the inflammatory response that's caused by poor oral hygiene. Research from the Oral Health Foundation reported that there are actually 5 main conditions that they linked to poor oral health: heart disease, strokes, diabetes, premature and low birth weights, and lung disease.
I think that's so interesting and so very important. It paints a good picture of how we certainly are interested in how this impacts our patients with cancer, but oral health is an issue that impacts all of our patients, no matter what their condition or comorbidity might be. So certainly an important topic for us to talk about today. Which types of cancers, or cancer treatments, or other factors are common contributors to oral toxicities that we see in our patients with cancer?
We know that treatment modalities for cancerous conditions include surgery, radiation therapy, chemotherapy, and now newer immunotherapies are emerging. We know that surgical procedures in the oral cavity can lead to altered anatomy that cause problems with chewing, swallowing, and due to an altered ability to form a bolus to swallow, alterations or removal of some of the minor salivary glands that lead to the oral cavity. Radiation, with or without a combination of chemotherapy, can lead to xerostomia, which is like a dry mouth. When this occurs, there's reduced or even absent salivary flow. When this happens, it can lead to mucositis, which is a very painful swelling of the mucous membranes in the oral cavity. This increases the risk of infection and compromises speaking, chewing, and swallowing. Certain chemotherapeutic agents can also accelerate and increase the severity of these side effects. Other factors, such as periodontal disease or dentation, and those comorbidities, such as those autoimmune disease that we mentioned earlier, along with sarcoid and Sjögren's, can also worsen these treatment side effects.
Now, Ray, you mentioned it briefly in our first question, but can you give us an overview of the role of the oral and the gut microbiome and how it plays into the oral health for patients with cancer and those that are receiving cancer treatment?
Well, as stated earlier, we know that the oral cavity contains bacteria, fungi, and other microorganisms. And these are collectively known as the oral microbiome. As stated earlier, they play a role in maintaining oral and overall health by aiding in digesting and protecting against harmful pathogens, along with contributing to our immune system and function. Now, the gut also harbors trillions of these microorganisms that form the gut microbiome. Research suggests that the mouth and the gut microbiomes interact with each other. They do this through a complex network called the oral gut axis. This bidirectional interaction occurs during various pathways, including the bloodstream, saliva, and the gut-brain axis, which connects the gut to the central nervous system. There was a study that was done in the Journal of Cancers that reported that oral and gut microbiomes interdependently regulate physiological functions and pathological processes. The oral to gut and gut to oral microbiome transmissions can shape or even reshape the microbiome ecosystem in our habitus and eventually modulate the direction of a pathogeneticist disease. These findings suggest that the bacteria in the mouth and the gut influence each other, and this can lead to a shared experience between the two, which give a significant implication for the development and progression of these diseases.
Well, that is truly fascinating. And I have a feeling that will be something that has continued to be studied and will likely be interacting with and influencing what we do in oncology. It sounds like that's just something on the cutting edge. So exciting to hear about that. How do you see the nurse's role in oral health as we interact with our patients with cancer? What are some of the nursing interventions that we should employ to help prevent or help treat these oral effects that our patients experience?
I think pre-treatment of the oral cavity prior to starting any of these treatments is a key to managing some of the side effects that can occur. This includes a referral to the dentist for any kind of extractions and removal of any non-viable dentation, along with providing some what they call fluoride treatments. The nurses can also influence the patient by helping them with their nutrition. It's important for them to continue to try to swallow despite some of the side effects that can cause the discomfort in swallowing. Some of the nursing interventions that I try to employ is encouraging our patients to try to continue to eat soft foods and to use gravies or sauces to help lubricate the food that they're eating, along with trying to maintain a good oral intake with water. Water especially, keeping them hydrated, will also help with alleviating some of these side effects.
Now, Ray, your specialty is head and neck oncology and oral cancers. What are some of the oral health issues that you see specific to this population of patients?
Well, I think the first step with that is educating our patients. Hygiene habits and routines. Do they brush daily? Do they drink alcohol? Do they floss? Do they see a dentist regularly? Do they smoke? Do they engage in oral sex? This puts them at risk for HPV-related oral malignancies. Do they use snuff or chewing tobacco? I have found in our Indian population, some of the patients there tend to use betel nut, which is an herb that they grind and they mix with lye, and they actually put it in their mouth. It's almost like chewing tobacco that gives them a bit of a high sensation. And this causes a tremendous amount of fibrosis in the oral cavity and can lead to oral cancers.
Well, that's very interesting and certainly a unique population and type of cancer to work with. So your insights are very important for us. Now that we've talked about some of the basics, let's talk about some of these concepts in practice. Could you maybe describe a case study of a patient who has experienced some of these oral effects and how they were managed and kind of what was the oncology nurse's role in that management process?
Most of our oral cancer patients are going to undergo at least one or maybe two, possibly three treatment modalities that we mentioned earlier about surgery, radiation, and chemotherapy. The side effects from the radiation and chemotherapy, we kind of touched on a little bit, but it does develop a lot of mucositis, especially with the radiation. Chemotherapy can actually accentuate this. There are products that we can recommend to the patients that can help decrease some of these side effects. Saligen, which is a pilocarpine, kind of protects the salivary gland along with stimulating some of the saliva. Another one is amifostine, which again protects some of the salivary glands from the radiation treatments. Other things out there are kind of a concoction that we call a magic mouth rinse. And it's a combination of viscous lidocaine and maybe some Maalox and Benadryl. And it kind of helps soothe some of the oral discomfort that some of our patients experience. I always encourage them to try to use soft bristled toothbrushes, water picks if necessary, soft foods, non-spicy foods, foods with moderate temperatures. And I kind of talked about this a little bit more, but trying to make sure that they have enough lubrication to get the nutrition they need by including some gravies or sauces or water to help them swallow when their saliva is altered due to these side effects from the treatments. I also encourage our patients, believe it or not, I recommend a non-sweetened iced tea. I think there's an ingredient in the iced tea that maybe it's the tannic acid, I'm not sure, but it does seem to help our patients as long as they don't add the sugar to it, and that seems to help them also. But again, referral to our dental colleagues in terms of pre-treatment helps with some of these side effects, along with maybe some of the pharmaceutical agents that are out there to help them with some of the discomfort to try to keep some of their salivary functions continue to function normally.
Well, I think you explained just how important it is for us as nurses to give our patients the information they need and prepare them for what their risks are, depending on what their treatments are or, where that radiation is targeted. Certainly, if surgery involves the mouth area, there are implications for our patients. And so giving them that awareness ahead of time and preparing them for what to expect seems to be a critical piece of our role as the nurse.
For the care involved, how can an interprofessional approach from the healthcare team support patients in managing oral effects?
I kind of work in an academic setting, and a lot of our cancer cases are reviewed by a multidisciplinary tumor conference that meets on a weekly basis. And these conferences are attended by our surgeons, our medical oncologists, radiation oncologists, radiologists, pathologists, oral surgeons, dentists. We even have nurses that are specialized in palliative care. Some of our nurse navigators are involved with this, our dietitians, and our speech pathologists. So in that kind of setting, we really have access to a multitude of different disciplines that can kind of help our patients get through these tough treatments. Collaboration, I think, is essential with our oral surgeons and our dental people to kind of help prevent some of the adverse side effects that can be caused by the treatments that these patients have to undergo.
I think you make a great point there in terms of just acknowledging the importance of the partnership that we have with our colleagues in sort of the dental medicine or the dental realm. Can you maybe give some insight on what would be some indicators or maybe some sort of red flags for nurses to consider of maybe that threshold of when they should make sure that they're facilitating that referral to dental medicine for our patients? Are there certain risk factors or assessment indicators that would make that referral something important to do right away?
I think a pre-assessment is always key, but your patient is going to kind of tell you up front, they're not going to feel like eating. You may see them drooling. They can't hold their saliva. And this may be as a result of some of the surgical alterations in the oral cavity that have occurred due to the surgery. So getting them to continue to try to swallow is probably key. So some of the early signs that you may be looking for is, of course, weight loss. Even a couple of, if they start losing weight while they're under treatment, you have to tell them that this is no time to be starting on a weight loss diet. You need to try to educate them on supplements, over-the-counter products like Ensure, Boost, Carnation Instant Breakfast. These are all things that they can add to their diet to help add calories. We know that the side effects that are caused by the radiation and the chemotherapy are temporary because these types of treatments, they're designed to damage cells. And they're not real clear on what's exactly a tumor cell and what is a cancer cell. So they damage cells in general. What makes the radiation and the chemotherapy effective is that they damage the tumor cells. We know that tumor cells are not normal. And because they're not normal, they don't have the ability to repair themselves after they've been damaged from the chemotherapy and the radiation. The normal cells that get damaged are what cause the side effects. And those side effects will subside because the normal cells have the ability to repair themselves. It's kind of like when you go out and you lay out on the beach and you get a nice sunburn. We know that the sun is damaging your skin cells and it causes a sunburn. And then that sunburn kind of turns into a suntan. But we know we're not tan year round because those normal cells that got damaged tend to repair themselves. The same is kind of true with some of the side effects that occur from the treatments that these patients undergo with the chemotherapy and the radiation. Those normal cells that get damaged cause those side effects, but because they're normal and because we can try to keep our patients well nourished, those side effects will resolve.
I think that certainly is important to share that information with our patients, that many of the side effects that they experience as a result of their active treatment do usually improve and some do resolve at the completion of treatment. There are some that occasionally do linger long-standing, and I think that is certainly important for us as nurses, especially from a quality of life perspective, of to kind of make note of those and don't overlook assessing those even long-term. As you noted, in the acute phase, it can be a risk for malnutrition, but in the long-term phase, there are impacts to quality of life that we certainly don't want to overlook.
I think one of the most common long-term side effects that I hear from our patient population is the dry mouth. That tends to stay with them because of the damage that's been done to the salivary glands. So as I mentioned earlier, there are some agents out there that can protect the salivary glands from the treatment side effects. But if you've got a carcinoma that is actually originating in a salivary gland, then you certainly can't utilize those. So again, the dry mouth is something that is a very, very common side effect from our patients that tend to go on. And again, there's pharmaceutical agents that can stimulate saliva, but for the most part, I tell them just to carry a water bottle, and that seems to help the best, and it's the least expensive.
So, Ray, in your experiences caring for many patients that do have head and neck cancers, I'm assuming that your sort of familiarity and relationships with dental colleagues in your area and at your institution, you've probably developed a good relationship there. So do you have any recommendations for how nurses can work with and develop that relationship with their dental colleagues to help ensure, we're collaborating and managing these patients in sort of a collaborative fashion and making sure that we're speaking to each other and exchanging that information well?
Again, I think the development of these multidisciplinary conferences are key to not only an educational process, but acts as a great referral process to our colleagues. Before any of our patients start any kind of treatment, they need to be seen by our dentists, whether it's their private dentist or one that's in our academic setting here. Having them remove any of the teeth that need to be removed. We know that the saliva acts as a protectant on our teeth. And when that becomes altered, the remaining teeth are at risk, I should say, for developing problems. Those teeth that have problems already need to be removed so that they don't cause an infection. And later on, they can cause a condition called osteoradionecrosis, where the actual bone starts to become infected as a result of the treatment of an infected tooth that may have been there. They also provide our patients with fluoride treatments, which again can help protect your teeth and your ability to eat and swallow during these treatments.
To touch briefly on patient education, what are some points nurses can emphasize to promote better oral health?
We know that the combination of tobacco and alcohol tend to have a synergistic effect, producing oral malignancies. So if you're a smoker, don't drink. And if you drink, don't smoke. Mm-hmm. Those are the two kind of takeaway messages there. Seeing your dentist on a regular basis is key to providing good oral health. Having your mouth looked at even after treatment with a dentist is important. Sometimes if we need to remove teeth, they can provide dentures to help continue with chewing properly.
Thank you, Ray, so much for all of the great information you've shared today. I think this is one of those topics that doesn't maybe get as much attention as some of our other side effects that we focus on and help our patients manage. But I think this is one that certainly patients feel the impact of And so I'm so glad that we had you on the podcast today to be able to talk about oral health in more depth. As we reach the end of our podcast, we do like to always run through a quick series of kind of some summary questions just to help us touch on some of the important points of our discussion today. So to start that off, what do you think are some common misconceptions about oral health in patients with cancer?
Yeah, what comes to mind is an old saying that if you ignore your teeth, they'll go away. I think that's a true statement. Not clear on any other misconceptions people may have out there. People may think they can get away without daily hygiene. I think that's kind of important, that you should at least get your teeth taken care of at least once or twice a day by brushing and flossing. I mean, this has been proven. Our dental people have really taken the lead on preventive care with oral hygiene in that respect.
I agree completely. I think a misconception is just that it's not that important. Like, it's just oral health. But I think you've done a great job on our episode today of explaining why that is absolutely not true. And that is a misconception if it's thought that just, it's just your teeth. Not at all true. So I agree with your statements there. Ray, what is something about this topic that's not often discussed, but you wish people knew more about?
I think the main cause of oral cancers used to be tobacco and alcohol. Nowadays, we're finding that the HPV virus is becoming more associated with these oral cancers, and we're seeing them in a much younger population. One of the things is very difficult to talk about is sexual habits. And then, of course, we know that the HPV virus can be transmitted through oral sex. So that's a topic that really needs to be discussed. The good part, though, is that patients that have been diagnosed with HPV positive cancers tend to respond much better to treatment and are surviving. It'll be interesting to see what will happen, because I know there about maybe 5-10 years ago, there was a big push to get vaccinated. So we'll see what happens to these patients and these kids that are being vaccinated now, where the risk factors will come as they get older.
Absolutely. And that's what I would chime in with too, is that it's not as often discussed as I wish it were, but there is a vaccine. There is an HPV vaccine. And as you said, it will take years for us to kind of see the overall impact of that. But that's certainly exciting for a cancer to have a vaccine that could potentially even eradicate or really significantly minimize the risk. So certainly exciting. Ray, what do you think additional training or education that oncology nurses need to stay current on the topic of oral health?
I've been working in the head and neck cancer field for quite some time. And over the years, I've come to realize that this is probably one of the most devastating types of malignancies that someone has. It's not like breast cancer or colon cancer or even lung cancer, because head and neck cancer and oral cancers, they affect your basic survival needs. They affect your ability to communicate. They affect your ability to take in nutrition. They can affect your ability to breathe, and certainly affect when someone looks at you, it's right there. It's staring them in the face. You can see, the side effects of their treatments. So to educate our nursing staff on stuff like this is extremely important, especially when they're going through these treatments, to realize that these patients are at a great loss of their survival coping skills. They have problems communicating. We all enjoy sitting down to dinner with our families and friends, and food is a very important cultural thing. And a lot of our patients can't tolerate those foods anymore, or can't even eat them by mouth. So a lot of those things need to be kind of discussed and try to come up with ways where our patients can still feel like they're part of a functioning society, so to speak, because this is so devastating in terms of their overall looks.
Yeah, absolutely right. And, staying focused on patients, are there any additional resources that you would recommend we sort of direct our patients to if they want to learn more, or if we need to help them understand their diagnosis more?
I know the American Cancer Society has always been a great resource for people. There are head and neck cancer societies that are out there. I actually participate in a national oral cancer screening program with the Alliance for Head and Neck Cancer, which is a national, it may be even international organization. And they sponsor screening programs throughout the year for various healthcare facilities.
Well, that's wonderful to hear. And thank you for sharing those resources with us. Ray, it's been a pleasure to talk with you today and to just learn a little bit more about oral health and your experiences working with your patients. Do you have any final comments to share with our guests?
Again, I appreciate the opportunity to talk with you today. This was, like I said, a first for me. I look forward to helping again wherever I can in that area.
Wonderful. Thank you so much, Ray.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.